This is All India Radio. We now bring you a special news program on COVID-19. Good evening. I am VC Pramod and with me is Vaibhav Srivastav. The headlines. Prime Minister Narendra Modi takes stock of Visakhapatnam gas leak situation. Expert teams of NDRF and NEERI to provide assistance in relief measures. Prime Minister stresses on coordinated efforts to tackle COVID-19 challenge. Reiterates India's commitment to universal service of humanity. Health Minister Harshvardhan reviews containment measures taken for COVID-19 management in Uttar Pradesh, Odisha and West Bengal. Vande Bharat mission begins to bring back stranded Indians from abroad. Government sets target of constructing roads worth 15 lakh crore rupees in the next 2 years. Prime Minister Narendra Modi today took stock of the steps in response to Visakhapatnam gas leak incident in Andhra Pradesh, which claimed 11 lives. He reviewed all efforts which are being made to tackle the situation on ground. Mr. Modi held a high-level meeting in New Delhi and discussed the measures being taken for the safety of the affected people as well as for researching the sites affected by the disaster. The meeting was attended by Defence Minister Rajnath Singh and Home Minister Amit Shah besides some senior officers. In the morning, Prime Minister and Home Minister talked with Andhra Pradesh Chief Minister Y.S. Jagan Mohan Reddy and assured all required aid and assistance from the centre to tackle the situation. They are monitoring the situation closely and continuously. 11 persons were killed due to gas leak from a private polymers company at Visakhapatnam today. Officials said 1,000 others living close to the factory have been exposed to the gas leak in Visakhapatnam. 200 to 250 families living in nearby areas of the factory have been evacuated. Briefing media in this afternoon, NDRF DG SN Pradhan said situation is now under control and leakage from the factory is now minimal.
The leakage situation is much better now in the sense that the silo that was leaking is now down to minimal and there is hardly any leakage there, and other measures to neutralize the entire chemical situation there is also being taken. So overall the situation is under control, and I think overall we can say that now it is a question of rehabilitation and treatment of the people who have been affected.
Cabinet Secretary Rajiv Gauba also took a detailed review meeting along with the Secretaries of the Ministries of Home Affairs, Environment, Chemicals and Petrochemicals, Pharmaceuticals, Information and Broadcasting, members of the National Disaster Management Authority and Director General National Disaster Response Force and others to chart out specific steps to support the management of the situation on the ground. The NDRF team with chemical, biological, radiological and nuclear defense personnel at Visakhapatnam was deployed immediately to support the state government and local administration. The specialized CBRN unit of the NDRF from Pune and an expert team from the National Environmental Engineering Research Institute, Nagpur, have left for Visakhapatnam. Besides, Directorate General of Health Services will provide specialized medical advice to the medical practitioners on the ground. Principal Secretary to Prime Minister Dr. P.K. Mishra held a high-level meeting with Cabinet Secretary, Home Secretary along with top officials of the National Disaster Management Authority, National Disaster Response Force, Director AIMS and medical experts on Vizag gas leak situation. Dr. Mishra directed sending of team of experts to Vizag for relief and rescue measures. President Ramnath Kovind and Vice President Venkaiah Naidu have expressed deep distress by the loss of lives due to the gas leak in Visakhapatnam. The Prime Minister also convened a meeting of National Disaster Management Authority in wake of the situation. Defence Minister Rajnath Singh and Home Minister Amit Shah were also present in the meeting. National Human Rights Commission NHRC has issued notice to Andhra Pradesh government and centre over deaths and sufferings of several people due to styrene gas leakage in Vizag district. In Chhattisgarh, 7 workers fell ill after being exposed to poisonous gas that leaked from a paper mill in the Raigad district. The incident took place when the workers were engaged in cleaning of a private paper mill located at Tetla village under Pusor police station limits. The plant was closed during the COVID-19 lockdown and was supposed to open after the state government relaxed lockdown restrictions. After few workers fell unconscious and others complained of uneasiness, the plant owner contacted a local hospital and arranged for their hospitalization. The condition of 3 workers is reported to be serious and they have been shifted to the hospital in Raipur.
Prime Minister Narendra Modi has highlighted the need for coordinated efforts to tackle the novel coronavirus challenge. He was speaking at the Buddha Purnima celebrations today via a video link. Ministry of Culture, in collaboration with the International Buddhist Confederation, IBC, a global Buddhist umbrella organization, had organized a virtual prayer event with the participation of all the supreme heads of the Buddhist Sanghas from around the world. The Prime Minister appreciated the compassionate gesture of dedicating the celebrations to the efforts of COVID-19 warriors and called for a coordinated effort to tackle the virus outbreak.
इस समारोह को कोरोना वैश्विक महामारी से मुकाबला कर रहे पूरी दुनिया के हेल्थ वर्कर्स और दूसरे सेवा कर्मियों के लिए प्रार्थना सप्ताह के रूप में मनाने का संकल्प लिया है। करुणा से भरी आपकी इस पहल के लिए मैं आपकी सराहना करता हूं। मुझे पूरा विश्वास है कि ऐसे ही संगठित प्रयासों से हम मानवता को इस मुश्किल चुनौती से बाहर निकाल पाएंगे।
Mr. Modi also remembered Lord Buddha's teachings and emphasized their universal nature. The Prime Minister also highlighted India's commitment to universal service of humanity. He said India would reach out to every nation with a sense of service.
भारत निस्वार्थ भाव से बिना किसी भेद के अपने यहाँ भी और पूरे विश्व में कहीं भी संकट में घिरे व्यक्ति के साथ पूरी मजबूती से खड़ा है। लाभ हानि समर्थ असमर्थ से अलग हमारे लिए संकट की ये घड़ी सहायता करने की है। जितना संभव हो मदद का हाथ आगे बढ़ाने की है।
The Prime Minister ended his message with an appeal to the people to stay safe and work for the service of others wherever they might be. Union Health Minister Dr. Harshvardhan today reviewed preparedness and containment measures taken for COVID-19 management in Uttar Pradesh, Odisha and West Bengal. He appreciated the dedication of all the states in combating COVID-19 pandemic. The minister stressed that states need to ensure adoption of infection, prevention and control practices in all healthcare settings to avoid and reduce chances of infections to healthcare workers. In view of the surge in number of migrant labourers expected to reach the states in the days to come, Dr. Harshvardhan exhorted the states that robust strategy and mechanism need to be drawn up for their testing, quarantine and treatment of the positive cases. He also suggested that along with the surveillance teams in the containment areas, community volunteers may also be identified at the ward level to spread awareness about the preventive measures like hand washing and physical distancing. A total of 52,952 confirmed cases of COVID-19 have been reported in the country so far. Out of them, 15,266 patients have been recovered after treatment and were discharged from the hospital, while 1,783 patients lost their lives. In the last 24 hours, 3,561 new confirmed cases have been reported. Health Minister Dr. Harshvardhan said that in comparison to other countries, India is in a better condition as the fatality rate is 3.3% and the recovery rate is 28.83%. He said the testing capacity has increased in the country and 95,000 tests are being done every day. The minister said more than 13,57,000 tests have been done so far for the COVID-19. As on date, there are 180 districts with no new cases in less than 7 days, 180 districts with no new cases in 7 to 13 days, 164 districts which have not had any new case in 14 to 20 days, and 136 districts with no new cases since the last 21 to 28 days. Dr. Harshvardhan said there are 13 states and union territories including Arunachal Pradesh, Chhattisgarh, Goa, Jharkhand, Himachal Pradesh, Jammu and Kashmir, Kerala, Ladakh and Odisha who had not reported any case in the last 24 hours. Daman and Diu, Sikkim, Nagaland and Lakshadweep have not reported a single case till date.
Amid unabated rise in COVID-19 cases in Mumbai, Pune, Aurangabad and other hotspot areas, Maharashtra Chief Minister Uddhav Thackeray today convened an all-party meeting through video conferencing. The meeting was attended by Deputy Chief Minister Ajit Pawar, Cabinet Ministers Ashok Chauhan, Balasaheb Thorat, Leader of Opposition Devendra Fadnavis and MNS President Raj Thackeray, among others. The Chief Minister said the suggestions made by the leaders will be taken seriously to fight COVID-19. Meanwhile, 22 new COVID-19 cases were reported in Aurangabad today, taking the total to 378 in the district. In Madhya Pradesh, 4 corona patients recovered from the infection after undergoing plasma therapy in a hospital in Indore. Family Welfare Minister Dr. Narottam Mishra encouraged these patients by talking to them through video calling. He said that treatment of plasma therapy would help in dealing with the corona crisis. More from our correspondent.
Indore District Chief Medical and Health Officer Praveen Jadia said that at Sri Aurobindo Institute of Medical Sciences, the use of plasma therapy was done on some COVID-19 patients, and according to the doctors, it helped them in the recovery. He said that plasma therapy would also be used at a government-run hospital in Indore very soon. Public Relations Officer of Indore Development Authority Vikas Bhalla, who got cured by plasma therapy, told AIR that he would also like to donate his plasma for other patients.
इंदौर में ये जो प्लाज्मा थेरेपी हुई है, ये इसके बहुत सुखद और सकारात्मक परिणाम आगे भी आएंगे और मैं चाहता हूं कि मैं 15 दिन बाद मैं खुद भी प्लाज्मा अपना डोनेट कर सकूं ताकि और 2 के जो मरीज हैं उनको लाभ हो सके.
With Maninder Dubey from Indore, Sanjeev Sharma, AIR News, Bhopal.
The total number of COVID-19 infected people in Tamil Nadu surged past the 5,000 mark today. In all, 580 people were confirmed with the infection, taking the total to 5,409, while the active caseload is put at 3,822. The death toll due to the pandemic has gone up to 37 with the demise of 2 people in the last 24 hours. Meanwhile, hectic efforts are on to identify the hidden cases in Chennai, which is the most affected district in the state. Our correspondent reports that testing is being done for all in the highly infected streets.
For the past 4 days, the newly identified COVID-19 cases in Tamil Nadu remains more than 500, with Chennai consistently sharing the most burden. However, officials say the most infected divisions in the city corporation have begun showing a declining trend, giving hope of flattening the epidemiological curve soon, if no fresh disease clusters springs up. 511 asymptomatic patients have been accommodated in the COVID-19 care centers in the Vaishnava College and Loyola College, 2 of the city's prominent educational institutions, and also the Chennai Trade Center. Meanwhile, the Chennai airport is gearing itself to receive people from the state who return from other countries from tomorrow. Quarantine facilities have been readied as per the standard operating procedures issued by the center. Jai Singh, AIR News, Chennai.
Karnataka has 308 active COVID-19 positive cases with 366 discharges and 30 deaths. 12 new cases and 1 death were confirmed today from Bangalore urban, Belagavi, Bagalkot, Divangir, Dharwad and Kalburgi. Totally 1,103 persons under observation are kept in isolation at designated hospitals across the state. Chief Minister P.S. Yediyurappa held a meeting with tax officials today and has given them instructions to plug all revenue losses. More from our correspondent.
Addressing the officials, the Chief Minister has instructed them to take strong action against false e-way bills, misuse of transportation rules. He, however, advised them to improve revenue collection without harassing the traders. Later, in a meeting with the farmers, the Chief Minister assured them that agriculture sector will not have any hindrance due to the lockdown. State Revenue Department Principal Secretary and Manjunath Prasad has written to the nodal officers appointed in each of the 9 states seeking to receive the migrant laborers. The states include Bihar, Uttar Pradesh, West Bengal, Madhya Pradesh, Rajasthan and Odisha. According to the sources in the Revenue Department, consent is received from Bihar and Madhya Pradesh. Sudhindra, AIR News, Bengaluru.
Uttar Pradesh has become the first state in the country to provide the facility of beds with ventilators in hospitals of each and every district of the state. Now all 75 districts of the state can provide higher level of care to the patients of COVID-19. Our correspondent has filed this report.
Now Uttar Pradesh has 24 testing labs for COVID-19 and around 1,300 beds with ventilator to fight with this deadly virus. Government has assured non-COVID hospitals that they should start treating patients and no action will be taken against them. Principal Secretary Health Amit Mohan Prasad said that at this time when large number of people are suffering from non-COVID diseases,
then hospitals should come forward and contribute in non-COVID care. Mr. Prasad said that we can only save the lives of people from COVID-19 through community surveillance. For this, government has constituted village supervision committees or Gram Nigrani Samiti in every village to curb the spread of corona. These committees will also supervise the persons who are coming from other states during their quarantine period and will inform accordingly to the administration. Sushil Chandra Tiwari, AIR News, Lucknow.
In Andaman Nicobar Islands, the last positive case of COVID-19 turned negative today. A report.
In Andaman and Nicobar Islands, the last positive case of COVID-19 turns negative today. Now with this, no more COVID-19 positive case remains and 100% recovery rate has been achieved. All the total 33 cases recovered. The Chief Secretary Chetan B. Sanghi informed about the update through his tweet. In his tweet, he mentioned about the challenge ahead is to have no fresh case even as islander returns and economy opens. He appreciated the effort done by Corona warriors. It is to mention that during the last 10 days, no fresh case of COVID-19 reported in the islands. Gaurav Padwal, AIR News, Port Blair.
This is All India Radio, bringing you a special program on COVID-19. Before we move on, a reminder of the headlines. Prime Minister Narendra Modi takes stock of Visakhapatnam gas leak situation. Expert teams of NDRF and NEERI to provide assistance in relief measures. Prime Minister stresses on coordinated efforts to tackle COVID-19 challenge. Reiterates India's commitment to universal service of humanity. Health Minister Harsh Vardhan reviews containment measures taken for COVID-19 management in Uttar Pradesh, Odisha and West Bengal. Vande Bharat mission begins to bring back stranded Indians from abroad, and government sets target of constructing roads worth 15 lakh crore rupees in the next 2 years. For quick news updates round the clock, follow us on our Twitter handle @AIR News Alerts.
In one of the largest evacuation exercises named Vande Bharat Mission, the government is operating 64 flights from this evening till the 13th of May to bring home nearly 14,800 Indian nationals stranded abroad due to the coronavirus lockdown. Minister of External Affairs S. Jaishankar on Tuesday urged the stranded individuals to stay in touch with the Indian embassies in their countries. The 64 flights will include 10 flights from the UAE, 2 from Qatar, 5 from Saudi Arabia, 7 from UK, 5 from Singapore, 7 from the United States, 5 from the Philippines, 7 from Bangladesh, 2 from Bahrain, 7 from Malaysia, 5 from Kuwait and 2 flights from Oman. Out of the total, 15 flights will bring back people to Kerala, followed by 11 flights each to Tamil Nadu and Delhi. 7 flights will be flying back people to Maharashtra and Telangana, whereas 5 flights are slated for Gujarat. The maximum number of flights in the first week of repatriation will bring back citizens from the Gulf countries. More than 350 Indians from UAE are flying back home today. India's ambassador to United Arab Emirates, Pavan Kapoor, spoke to AIR News on evacuation of Indians from the UAE.
I'm very pleased that the process of repatriation of overseas Indians is beginning today from the UAE, a place where we have amongst the largest diaspora of Indians in the world. This has come about today due to the joint effort of the whole Government of India, the Ministry of External Affairs, the Ministry of Civil Aviation, the Ministry of Home Affairs, and of course the Ministry of Health and Family Welfare.
Talking to AIR News, some of the Indian nationals welcomed the evacuation exercise.
So myself, Vinny Devanan from Abu Dhabi. I'm going to Kochi. Sincere thanks to Embassy and the Consulate. Actually, I'm a brain tumor patient. I'm going to Vijay CMC Hospital for the primary and the detailed checkup.
I'm Tina Shaijan. Due to pregnancy, I'm going to Kerala now. I'm very thankful to the Indian Embassy who provided this opportunity.
More from our West Asia special correspondent.
All passengers on the Dubai-Kozhikode flight were found asymptomatic and were grateful to be part of the first repatriation flight. Ambassador Pavan Kapoor at the Abu Dhabi airport and Consul General Vipul at the Dubai airport personally saw the entire operation. Medical screening was done for all the passengers who were there to take off. All the passengers were handed over a kit containing masks, gloves, and small pack of sanitizers. Passengers also had to sign a paper stating that they will be in complete quarantine for 14 days after reaching back. Apart from the distressed workers, there were pregnant women, senior citizens, cases of bereavement, students, and some others too. In the coming days, there will be more flights to other destinations in India and most stranded Indians will be back home. Tomorrow, there are 2 repatriation flights to Chennai from Dubai. Kanchan Prasad, AIR News, Dubai.
Indian Navy ship INS Jalaswa reached Maldives' capital of Malé today as part of efforts to repatriate Indian nationals from foreign shores. The program, named Sumudra Setu by Indian Navy, entails to bring back around 2,000 Indians in 2 ships during the first phase of evacuation.
In our series Experts Speak on All India Radio, we bring you the views of the leading medical experts on COVID-19. Talking to All India Radio News, Dr. Naresh Gupta of LNGP Hospital, Delhi said that in most of the cases the COVID-19 infections are self-limiting and very few patients are required to take admission in the hospital.
कॉमन कोल्ड और कोरोना वायरस दोनों की दोनों आम तौर से अपने आप ही सेटल कर जाते 80% में तो ऐसी भी तकलीफ नहीं करते हैं या इतनी हल्की करते हैं कि लोग घर पे ही ठीक हो जाते हैं 10-15% में उनको अस्पताल जाके कुछ दवाई दी जाती है और वो सेटल हो जाते हैं 5% या उससे कम वाले हैं जो कि दाखिल होना पड़ता है.
Talking to All India Radio News, Director AIMS Dr. Randeep Guleria advised the people, and especially to those in the hotspot areas, to sincerely follow lockdown measures to break the chain of transmission of COVID-19 infection.
I would advise everyone, especially those who are in the hotspots, to really sincerely, as citizens in a patriotic manner, observe this lockdown, because if we observe this lockdown in a sincere manner, we will be able to break the chain of spread and we will be able to bring down cases and be able to prevent deaths and conquer corona in India.
Celebrities from different areas have been appealing to the people to join hands in the fight against the COVID-19. Bollywood actor Varun Sharma appeals to the people to stay at home during the lockdown and help contain the spread of coronavirus.
नमस्कार दोस्तों, ये जो कोरोना वायरस की जंग है, हम सब मिलके इसको लड़ रहे हैं और हम जीतेंगे. प्लीज आप सिर्फ घर पे ही रहिए, बिल्कुल भी बाहर मत निकलिए. इससे आप अपने आप को बचा रहे हैं, अपने घर वालों को बचा रहे हैं, अपने दोस्तों को बचा रहे हैं, पूरे देश को बचा रहे हैं. प्लीज लेट्स जस्ट बी एट होम, लेट्स जस्ट स्टे एट होम एंड स्टे सेफ एंड यूनाइटेड वी स्टैंड एंड वी विल फाइट दिस.
Union government today said that states and union territories have lifted 70 lakh tons of food grains under the Pradhan Mantri Garib Kalyan Ann Yojana, which is about 58% of the total allocation for 3 months. Under the scheme, 5 kilograms of food grains are being distributed free of cost for 3 months to about 80 crore beneficiaries across the country. Consumer Affairs Ministry has said that every state has completed lifting of the stocks against April 2020 quota, and 5 union territories have completed lifting of entire 3 months quota. The ministry said procurement of wheat and rice during the ongoing Rabi season has picked up pace despite severe logistical constraints posed due to the countrywide lockdown. Against the target of 4 lakh metric tons of wheat, procurement of our central pool has touched 216 lakh tons till yesterday. Amarjeet Kumar Singh of Samastipur, Bihar, has received benefits under the PM Kisan Samman Yojana. He said the scheme has provided a much-needed support during the COVID-19 outbreak.
मेरा नाम अमरजीत कुमार सिंह, समस्तीपुर जिला के कल्याणपुर प्रखंड वासुदेवपुर पंचायत वार्ड नंबर 2, जिसमें किसान सम्मान निधि योजना के तहत लॉकडाउन में 2000 रुपया मिला. इसके लिए मोदी सरकार जी को धन्यवाद.
Union Minister for Road Transport and Highways and Micro, Small and Medium Enterprises, Nitin Gadkari, today said his ministry has set a target of constructing roads worth 15 lakh crore rupees in the next 2 years. He said the ministry is working overtime to clear all arbitration cases with concessionaires. Mr. Gadkari was holding a meeting via video conferencing with the members of Society of Indian Automobile Manufacturers on the impact of COVID-19 on auto sector. Mr. Gadkari suggested that the focus should be on enhancing liquidity in business as ups and downs are common. The minister informed that the officials have been asked to finalize the auto scrapping policy quickly and said it will go a long way in cost reduction. He also suggested exploring cheaper credits, including foreign capital, for enhancing liquidity in the automobile manufacturing sector. During this interaction, members expressed concerns regarding various challenges being faced by industry amid COVID-19 pandemic and gave some suggestions and requested support from the government to keep the sector afloat. Mr. Gadkari assured all possible help from the government. On the question of BS4 vehicles, he said the government is bound by Supreme Court verdict on the same. He, however, said on industry's suggestion he will get the matter examined afresh. Regarding relaxation sought on other regulations, Mr. Gadkari stated that he will endeavour to provide relief wherever possible where industry is seeking extension of time.
Union Home Minister Amit Shah has expressed pain at the deaths of two brave BSF soldiers who were battling COVID-19. In a tweet, Mr. Shah extended condolences to the bereaved families. He hoped that God gives them strength to withstand this loss. The News Services Division of All India Radio, in its bilingual live phone-in program today, will bring you a special discussion program on COVID-19. Dr. Sanjay Pandey, senior physician at GB Pant Hospital, will participate in the discussion. Listeners can ask questions to the expert on toll-free telephone number 1800-115767. You can also ask questions on telephone number 011-2331 4444 and post queries on our Twitter handle @AIR News Alerts by the hashtag AskAIR. This can be heard tonight on FM Gold channel and additional frequencies from 9:25 p.m. onwards. This program will also be available on our website newsonair.com and on our YouTube channel News on Air Official. You can also follow us on the News on Air app for updates. Public sector banks have sanctioned loans worth 5.66 lakh crore rupees for more than 41 lakh 81,000 accounts during the March-April this year. In a series of tweets, Office of Finance Minister Nirmala Sitharaman said these borrowers are from MSME, retail, agriculture and corporate sectors waiting for disbursal soon after the lockdown lifts. For MSMEs and others, pre-approved emergency credit lines and working capital enhancements are being prioritized by public sector banks. More than 27 lakh customers have contacted from March 20th and 2.37 lakh cases have been sanctioned loans worth 26,500 crore rupees. Public sector banks complimented RBI on loan moratorium. Their effective communication and proactive actions ensured that over 3.2 crore accounts availed 3-month moratorium. Quick query redressals allayed customer concerns and ensured responsible banking amid the lockdown.
In Himachal Pradesh, Chief Minister Jairam Thakur addressed various Panchayat Pradhans of Siraj Vidhan Sabha area of Mandi district through video conferencing today. Chief Minister asked Pradhans to strictly ensure to follow the norms of home quarantine and social distancing of residents who recently returned to their villages from various parts of the country due to nationwide lockdown. More from our correspondent.
Chief Minister Jairam Thakur also asked Panchayat Pradhans to ensure that the fight is against COVID-19 virus but not with the people suffering from this disease. He said it must be ensured that no social stigma is linked with this virus. He directed the officers that individuals arriving from the red zone must be kept in a quarantine center. The state government has also decided that if anyone found violating the home quarantine norms, he will be shifted immediately to institutional quarantine. Meanwhile, in Himachal Pradesh, one more fresh case of COVID-19 has been registered today, taking the total number of active cases to 6 in the state. The total number of virus cases in the state has risen to 46. However, 34 COVID patients have also been cured in the state. 2 patients also died due to coronavirus. Sanjeev Sundaryal, AIR News, Shimla.
In an effort to guard against fake news being circulated on various platforms, we bring you our segment on fact-checking and mythbusters. The Central Board of Indirect Taxes and Customs has refuted claims that the government is offering any refunds. In a tweet, CBIC appealed to taxpayers to not click on any fake link which promises to give refunds. It said that these are phishing messages and are not sent by CBIC or the GST network. And now, before we end, the headlines once again. Prime Minister Narendra Modi takes stock of Visakhapatnam gas leak situation. Expert teams of NDRF and NEERI to provide assistance in relief measures. Prime Minister stresses on coordinated efforts to tackle COVID-19 challenge. Reiterates India's commitment to universal service of humanity. Health Minister Harshvardhan reviews containment measures taken for COVID-19 management in Uttar Pradesh, Odisha and West Bengal. Vande Bharat mission begins to bring back stranded Indians from abroad. Government sets target of constructing roads worth 15 lakh crore rupees in the next 2 years. For details of these stories and more, log on to our website www.newsonair.com and News on AIR app. And with that, we end the special news program on COVID-19.